Second day of the conference, InnoHEALTH 2017, Transforming Healthcare Through Innovation. To start with today's session, I would now take the opportunity to invite Professor Rishikesha T. Krishnan, Director and Professor of Strategic Management, IIM Indore, on the dais for a keynote address.
Very good morning to all of you. Let me first thank Dr. V.K. Singh for inviting me to come and speak here. I've been watching with great admiration the progress being made in healthcare innovation by Dr. Singh and his team, and I'm delighted to be here with all of you this morning. I'm going to speak about making frugal innovation work in healthcare. I will be, of course, using a lot of well-known examples, but the purpose of my talk is not so much to dwell on the examples, but to provide a framework for looking at how to make frugal innovation work in this sector. Now, what is frugal innovation? I think it doesn't really need much introduction to this audience, but in our research, we found there are three important elements which go into frugal innovation. The first is a frugal mindset. The second is to follow a frugal process, and the objective is to have a frugal outcome. What do we mean by a frugal mindset? One of the best ways of representing a frugal mindset is this comment which I came across from Ingvar Kamprad, the founder of IKEA. He said that the challenge is not in building a desk that costs $1,000, but in designing one that is functional and elegant for $50. So that's very much the challenge of frugal innovation in healthcare as well. You can certainly come up with the most expensive and most sophisticated equipment, instruments, procedures, etc. But how do you come up with methods and processes that are affordable in a country like India? That is the challenge you have to take up. And to take up that challenge, to be excited by that, a frugal mindset is most important. The second important part is a frugal process. Usually, R&D is seen as a very expensive activity, which involves huge investments with uncertain outcomes. So, bringing economies in the process is very fundamental to achieving frugal outcomes. So, what we find in the research literature is that a frugal innovation process is dependent on certain principles, some of which I'm sure are being discussed in this conference. These include lean management, minimalism, waste minimization, clean sheet design, questioning the basics, and other things like relentless optimization. So your ability to use a process that is frugal itself and results in frugal outcomes is the second dimension of what frugal innovation is about. And last but not the least, what we are looking for is a frugal outcome. This is fundamental to frugal innovation. Without a frugal outcome, no frugal innovation is achieved. So what we are looking for is significant cost advantage or a gain in productivity or an increase in functionality per unit cost, which of course results in disruption in features, affordability, and ease of use. So I would just like to reiterate that when we are talking about frugal innovation, we are talking about a frugal mindset, getting excited by coming up with really low-cost solutions, a frugal process, and of course, seeking frugal outcomes. We are fortunate that in India, we have seen a large number of innovations that have these characteristics. This is from a study done by a UK consulting firm called Nesta a few years ago, and you will recognize several familiar examples on this chart, which represent some of the best frugal innovations in healthcare and other sectors that come from India. So my focus of today's talk is on what are the core principles of frugal innovation. What do you really need to do if you want to have these frugal outcomes? So we have developed a framework in our research which looks at some basic principles which drive any frugal innovation. and we have captured them in an easy-to-remember mnemonic called responsive. What are these different principles? They center around requirement identification, starting from scratch, process redesign, open collaboration, nothing to be taken for granted or as given, simplicity, iterative optimization, virtual intelligence, and economies of scale and scope. So I will just, in the few minutes I have with you this morning, I will just explain how each of these works in the field of healthcare. So let's start with requirement identification and redefinition. Essentially, what is important here is to identify the core functionalities required without compromising on basic safety or performance. Many equipments, particularly in the health sector, are very expensive because they provide lots of bells and whistles, which might be expected by certain doctors and hospitals, but are not core to the functionality which the particular instrument provides. So the key is to be able to identify what are the core functionalities which are actually required. So if you take this photograph of a doctor using a portable ECG machine outside a public health center somewhere in, I think it's in Andhra Pradesh, you will see that there are certain things which need to be incorporated and certain things which are probably not that important. What are the things which need to be incorporated? And that's captured in this very simple product, as opposed to one with more bells and whistles that you would see in a common hospital. There are certain things which need to be present in that particular instrument. It needs to be able to show any irregularities in the heart pattern, which is what ECG is all about. It needs to be able to work without a regular power supply on a battery because power is not reliable in those areas. It needs to be rugged and dust-proof because, as you could see, it has to be used in very tough conditions. And it would be really good if it has some built-in intelligence because you're not always going to have a trained doctor at hand to use that instrument. So if you can design a product around these core functionalities, as has been done in the case of portable ECG machines, then you are well on your way to achieving frugal innovation. And you can see that the product I showed you was from GE, which is small, compact, battery-operated, has a very simple printer, and is, of course, a low-cost machine. What is the second principle of frugal innovation? Essentially, it's to start from scratch. Why is starting from scratch important? The moment you start with a more sophisticated equipment and you try to remove features, you're essentially going to be locked in to certain costs which are already associated with that instrument. Whatever you do in defeaturing, delayering, you're not going to be able to bring it down to a really low cost. So the second important principle of frugal innovation is to start from scratch, start from a clean slate, so that you build upwards and you incorporate all the critical functionality that is required. The third important principle of frugal innovation is redesigning the process or re-engineering the process. This has been at the heart of some of the best frugal innovation we have seen in healthcare in India. If you look at the whole Arvind Eye Care model, which I'm sure many of you are familiar with, you would see that it's really come about not because of any revolutions in technology, not because of any other drastic changes, but really in looking at the whole process through which cataract surgery is done, identifying where costs can be removed without compromising on quality, and then redesigning the process to make that happen. For example, the whole concept of an assembly line where you have paramedics doing a lot of the support activities, doctors just doing the critical parts of the cataract surgery, essentially is a process redesign activity. So this is very key, once again, to making frugal innovation work. The next important part of making frugal innovation work is open collaboration. Now, why is open collaboration important? Because no organization can have all the expertise it requires within the organization itself. And to make frugal innovation possible, you need to collaborate with others who can contribute to your efforts. We have one example of frugal innovation in healthcare in India, which is perhaps not yet completely successful, but certainly has a lot of potential, and that is the whole idea of changing the process of drug development from the traditional single organization model to an open source drug discovery model, where you have multiple institutions, multiple research centers, all collaborating with each other, each doing individual parts of the process, ultimately resulting in drug discovery that is not owned by a single organization and can then be commercialized at a much lower cost. The next important step is to not take anything for granted. I think if you just look back at the success of Narayana Hrudayalaya, which has been talked about a lot, the key thing is that somebody like Dr. Devi Shetty, he did not assume that cardiac surgery is the way it is. He said there has to be ways of finding better ways of doing this, which actually brings down cost. There have to be ways of questioning many of the assumptions we have already made, even if it's something as complex as cardiac surgery. And that's what has really enabled him to continuously push the boundaries as far as bringing down the cost of cardiac surgery is concerned. This is very intimately linked to the frugal mindset that I talked about right at the beginning of my presentation. And even something like the Care Companion program, which is part of Narayana Hrudayalaya's approach, which says that you don't necessarily always need trained healthcare professionals to provide patient support. The family can also be trained to do so. That's again a very creative, out-of-the-box kind of idea, which came about because Dr. Devi Shetty questioned all the assumptions which go into conventional cardiac care. What we also find in this model is that if you want to have really frugal innovation happening, simplicity is at the core. Simplicity is what brings down costs. Simplicity is what makes things easy to operate. Of course, at one level, it means no frills, but it also means bringing down costs, making things easier to use. That's also at the heart of simplicity. To me, one of the best examples of simplicity is something like the Jaipur foot. You can see how it's been fabricated. It's not made of very complex materials. It's made of very easily available raw material. It's something which can be made by craftsmen who are not all that skilled. It can be easily adapted to the individual patient or user. This is an example of a simple innovation which is finally frugal yet very effective. Another important principle of frugal innovation is what we call iterative optimization. What is iterative optimization? It's saying, again, it's the process of repeatedly finding ways of lowering cost that actually brings down the cost. It's not a one-time activity. It's something which you have to persist with. Every iterative cycle can result in further lowering of the cost. And if you look at the kind of improvement philosophy that an organization like Arvind Eye Care or an organization like Narayana Hrudayalaya has, you will see that that's what drives them to continuously find better and better ways of providing the healthcare services that they do. Increasingly, we find that an important element of frugal innovation is virtual intelligence. What is virtual intelligence all about? It's saying that we can use IT to bring in expertise into equipment, into diagnostics, into healthcare. One example I found very interesting is a few years ago, I visited this organization called Sugavarvu Healthcare in Tanjavur, in Tamil Nadu. As is well known, India has a shortage of trained medical practitioners, yet we have a huge army of people who practice traditional medicine, particularly Ayush. Now, these Ayush practitioners, whether you like it or not, are already acting as doctors. But can you make them more effective in what they do? This is where Sugavarvu Healthcare has developed an expert system which resides on a laptop, and you have this Ayush practitioner feeding in data from the patient. As she talks to the patient, the computer keeps generating various options to help the Ayush doctor do the diagnosis, and then finally it comes out with a much better diagnosis than the practitioner would have done on her own. I found this to be a very interesting system, and it actually seems to work quite well in providing Ayush practitioner with the expertise required to do a better job. And this is happening because of the virtual intelligence which is embedded in that particular laptop. Finally, one of the most important drivers of frugal outcomes is economies of scale and scope. Economies of scale and scope are talking about reuse. They're talking about optimization as a network rather than as a single organization or hospital. One organization which is doing this in a very interesting way is LifeSpring Hospitals in Hyderabad. LifeSpring Hospitals focuses on core maternal health, but they have a very interesting network of small hospitals around a central diagnostic facility. So the hospitals themselves are located where the patients are, in largely low-income areas, but to save on cost, they have certain common diagnostic facilities which are at the center. You could think of this as something like a Walmart model, where the warehouse and the fulfillment center is at the center, and all the stores are around it in a network. So this is like applying a Walmart model into healthcare, which is not normally thought of, and basically using specialization, standardization to bring down costs. So essentially what we are saying is there are very well-established principles to make frugal innovation work, and these can work in healthcare as well. Before I conclude, I would just like to share with you a few myths of frugal innovation which you might want to guard against. The first one is that please don't associate frugal innovation with cutting corners. Frugal innovation is all about robust solutions that provide good quality healthcare but at low cost. So Arvind Eye Care, Narayana Healthcare, they don't compromise on quality. They have the same standards as the best hospitals, but they still deliver good quality solutions. It's also a myth that frugal innovation doesn't require good engineering. In fact, it's the opposite. You need really smart engineers, really smart doctors who can come up with innovative solutions that are also low cost. And obviously, therefore, it doesn't depend on low-cost engineers or doctors as well. Frugal innovation doesn't need market insights. It couldn't be farther from the truth. Understanding consumer needs, understanding the needs of the healthcare system, understanding the needs of doctors is crucial. So being very user-oriented is critical to making frugal innovation work. And last but not the least, in the West, there's a general belief that innovation is all about understanding unarticulated needs. That's because most of the well-known, well-established needs have already been met. In a country like India, where frugal innovation is required, it's not really about unarticulated needs. There are well-known needs which are not being met. There are basic aspects of healthcare, for example, which are not being met. So the needs are out there, staring us in the face for all of us to see. The challenge is, can we go and look at them and find better low-cost solutions to solve those problems? And we also need to worry about one other factor. We need to make sure that we don't do unsustainable frugal innovation. What does that mean? Making your frugal innovation depend on subsidized inputs, not a sustainable solution. Cannot create innovation with high negative externalities, which means transferring the cost to somebody else. That's not a genuinely low-cost solution. You can't depend on labor cost arbitrage alone. And of course, quality is never a substitute and should not be thought of as a way of finding your way to frugal innovation. And of course, you want to make sure that the user experience always has integrity, that the user gets a very good experience out of the whole thing. So before I close, just to remind you once again, these are the basic principles of frugal innovation. You need to be careful about what requirements you identify the requirements of the core functionality, start from scratch so that you don't have costs embedded in the innovation process. Look at process redesign. That's often a great area to look for innovation opportunities. Collaborate through open models. That's a way of getting the best expertise and bringing down costs. Don't take anything as granted or forgiven, because clearly any assumptions have to be questioned. Focus on simplicity. Iterative optimization is the key. Bring in virtual intelligence. Use IT to embed intelligence in your solution. And finally, use economies of scale and scope. If you can use all these principles together, you have a much better chance of being successful in frugal innovation. Thank you very much.
Thank you, sir. We request you to please have a seat. I now request Dr. V.K. Singh to make a few words.
Thank you very much, sir, for your really illustrative talk. We really benefited. And I take some liberty to take 4 minutes because he has mentioned about innovation curious, which were born 2 years back, and we have reached up to this stage. And there have been a lot of questions people have been asking, so I'll quickly cover those questions. Maybe you may like you to be part of it in future whenever possible. Incidentally, I have advisors from across the globe except South America. If somebody is from South America, I think we'd like to induct. Otherwise, I have to scout around because that's a continent I have not seen. Other places where I've been, I always have good friends, academic, etc. And he's also one of our advisors. They are the one who give us a direction and we implement. In addition to, I just want to introduce Professor Ronald. Ronald, he is one of the advisors from Canada. Professor Venkat, he is another person. Professor Ganju from the USA, and many others who are not here. Idea is, let's share from the developed or developing countries our viewpoints and make a optimum cost of healthcare delivery. Also keep the quality, what Professor has said that. So we have scouted around. Europe, we have very strong presence, and they brought their products that they are price sensitive to India, and they are also will help us to take this to the last mile. And I'm also learning innovative way. I have never been a business person. I have been little academician, that's fine. But learning from all my IIM colleagues, I'm learning innovative ways how to take this forward. This is the conference, this is the second one which we are doing. We have upgraded it and we have learned it. And the next conference is already announced, 5th, 6th October. Those who want to pay 2,000 plus taxes, 22 people have registered, and somebody said, I asked why you have registered. He said 5-star, I think for 2 days, lunch and 2 teas, okay. So their concern was food, not that much of a concern of academics. I have written a book. The first book, Professor Ganju is there, co-author. Sandeep Bhalla is sitting there. They all have written the first book, which is published in US. 3,000 copies have been sold. A year back it was published. This is the book, I'll leave it at the reception. Second one, planning and designing, is in the galley. The final print form is not yet come. It will come next month. It got delayed because of this hurricane business. Their Florida offices were closed. I was talking to the director. I'm not interested. I don't think I need to put anything in my CV. I want younger lot to come up. So maybe, I'm not promising, crowd here, if you give me an idea, we can think of another book, Innovation Outcomes in Health Sector. Success stories, challenges, problems, incubation, all that is the buzzword of today can be brought in. Sandeepan has already volunteered from Galaxy and his people, and I think my experience have been publishing a book. Abroad is more cleaner. Here they want to have lots of bargaining, etc. And when it comes from the USA, anything which comes from the USA or from the Western world, people say, this is quality work. It is published there, so probably that's another factor. Anyway, the publisher is known, we can do that. I'll request the professor here, Venkat here, our all advisors, I'll request. But I'm more interested in the younger lot. So if you are interested, I'm not promising it will come, but I will think of it. So you can give me your name, number, etc. We'll contact you at appropriate moment. But I want to encourage the younger lot, definitely. We have quarterly webinar, which is a complimentary, and all from the globe, senior people talk. We have requested our advisors by rotation because they are very senior people. And probably if anybody wants to, because I know some people, and additionally, if somebody wants to, we can do that also. We have created a club, IC Innovators Club. That's more for younger lots. I have very senior people who are the advisory group. He's one. We'll have a couple of chapters in a couple of places. And ultimately, this is particular thing which has been done. There are legal fellow, there's an investor, there's a financer, there's an incubator fellow, and all these people. To start with, we have just taken 50 people. So tomorrow, 55 people anybody who's interested to how it will work, how it will look like, you can most welcome to join. You can just let me know. It is a IIC center in Delhi here. And those who are staying in this hotel will organize the transport also. Alok, can you, okay? So he's the person you can give. It will take the people from here, those who are in this hotel, to take them to that place. So this is another one. The government of India is very keen to support it so that young innovators, we have a Young Innovator Award. He's the person who is one of the jury, chairperson of the jury. We are giving that and we want to encourage them. Now they are the person who can have a hand-holding there. So there are people who want to really come and support this initiative, and we'll have many more chapters. So those who want, they can go, I see desk, InnovaSecure is desk, fill up their detail or talk to me, no issue at all. We have launched a training program. Mind you, these are not so far any commercial activities. They're yet to become self-sustaining activities. That's all my aim is. We have launched a cybersecurity because my partner is a double master from the European University in cybersecurity. We have done for Ministry of Defense. We are launching in November for the health sector. And we are also, I have done something on health innovation operations in the hospital operation and healthcare operations by innovative method. Government of India supported. We have done 10 days program. Now we want to bring 5 days. NIT Raipur is planning something like this. So we have 1 day, 2 days, 3 days. Cybersecurity is another one. And based on this book, I've been teaching this for many years. Hospital planning, designing, lean innovative evidence approach. We'll have this kind of training programs also. So this is a nutshell. I just wanted to take it to the younger lot. I want to take it that there is a holding hand. And Government of India was very, very keen. HRD is supporting, BIREC, Science and Technology is doing it, and I'm sure academic institutions are our advisors. They will also support our initiatives. This is just, they don't have to really worry. We will have one webinar only, how to get the funding. Tomorrow, I think from BIREC and USAID, etc., in the club, somebody talking, how can you get the money? That's important. I find some of the ladies, they're all money ladies. There's lots of money. They want to really support your initiatives. There were 2, 3 yesterday have come. Today also they will come. This is nutshell. I just wanted that what is in with us, please get linked up. We will write your thing in magazine, whatever you have done. Neither we pay money for writing in magazine, not we charge. And this is going to 28,000 people through Amazon. E-copies, we have a limited printed copy. This is just for information. This is what is people have been asking, so I thought I'll do that. Sir, and thank you very much. He has come all the way, and that's the spirit. Anybody who has come from India and abroad, they know that we are for the good cause. I'm really grateful they have come on their own. They're staying on their own, and still sharing their experience, and they're doing for taking the next step forward. I am with you, and I want all of you to be with me as well. Thank you very much. May I now request Professor to take small moment of honor. Thank you. Your phone will not go off, so we will say power pack. Thank you.
Moving on to the next session, themed Healthcare Beyond Hospitals, I would like to invite Professor S. Venkataramanaiah, Associate Professor in Operations Management, Fulbright Scholar, US, Indian Institute of Management, Lucknow, Noida campus, on the dais for keynote address of the session.
Very good morning to all of you. I think I have a very tough task after a very prominent speaker and a person who has achieved something and those who have contributed in this area Either you call it as healthcare or innovation. And I will try to do my best to share some of my thoughts on this topic. Working with Professor Dr. VK is both pleasure and challenging. Let me start with that. So he has given me a topic that, Venkat, you should talk on this. I only know that healthcare happens in hospitals and to some extent outside hospitals. So let me ask you a couple of things. That is my strength also, interacting with either class students or the participants like you. So how many of you have gone to hospital for either for consultation with a doctor or testing for some diagnosis, etc.? Can you raise your hands? Those of you who have gone to hospital in the last 6 months? Okay. How many of you have invited, let us say, a lab technician to your home? Can you raise your hands? Okay. So at least to me, and as far as my family also concerned, I stay in Noida. Whenever I find something has to be done, we'll give a call at least 2 people. Either it is Lal Path Lab or A to Z. Whoever comes, let us say, on a given time, we prefer them. It's not the question of one person anymore or one organization anymore. You have a number of organizations. That's what I want to point out from this example. So like that, there are a few. Without taking much of your time, let me go through my slides. So as you know, India is a very fascinating country, comes with a lot of both positives as well as negatives. This slide gives you some idea about those positives and negatives. On one side, you have very prominent achievements like satellite launching. So some of the prestigious countries in the world are partners with us, or vice versa. So that is one side. But on the same way, we also have very poor healthcare indicators. WHO publishes every year on year. If you look at that report, it concerns everybody. So I don't want to tell you how badly we are performing on some of these indicators. So this gives you some idea about how the India is performing. 1.3 billion population country is performing in terms of healthcare indicators. And one of the reasons for this is affordability. So speakers yesterday talked about a lot of things about pricing, affordable healthcare models, and so on and so forth. And my basic research interest is also on affordable healthcare delivery, particularly for bottom of the pyramid consumers. So in this process, we have been working with a few organizations, particularly healthcare organizations. I'll be drawing some insights based on my interaction with that. So this slide gives you very upside down view of the healthcare spending by Government of India or public spending. As you can see from this slide, though the numbers are a little older, but by and large, these figures are not much changed over a period of last few years. So this gives clearly that there is a huge demand on private healthcare. Because of that, the Indian healthcare system is becoming less affordable for many people. Unless you are covered by some insurance or some of your employers and so on and so forth. And the thing is, including some of the multinational companies, healthcare coverage is only for the employee, not for the employee's family anymore. So such kind of things are also happening that we are seeing. So on the other side, there is a huge change that is happening that you can call the healthcare, like anytime assistance for your roadside vehicle assistance. As you can see, there is assistance for this in this country for almost everything, but you cannot have such kind of assistance for very precious healthcare. So your vehicle is stuck either due to any reason on any part of the highway or even remote part of the country, that you can call whatever that number, and within, if not minutes, but within a reasonable amount of time, you can get the assistance wherever you are. but I don't know when such kind of thing is going to happen for the healthcare. So these are some of the healthcare forms in India, particularly the hospitals, the home care. Home care is growing pretty faster, and the lifestyle centers, and also the community health centers, and education institutions focusing on primarily on health of their employees, as well as some of the facilities that they can extend to the local communities. So believe me, some of the organizations are also becoming, education institutions are becoming partly the healthcare providers also now and then, if not on continuous basis. And to your information, I hope some of you must be aware UP 100. How many of you are aware of UP 100 in UP? Kindly raise your hand. Wow. This UP 100 is one of the prestigious projects of UP government. In this, on an average every day, about close to 600 cases have been supported by this UP 100 service and shifting them to hospitals for emergency care. So that is what is the care that is happening in this country, particularly the state like UP, and that has become one of the very, very prestigious projects of this country. And also they are also competing for Scotch Award and so on and so forth. Those of you who are interested, please visit UP 100 and you will find a lot of details on that. So I came to, we are working with them also at my institute level, and they are also partnering with us. So why I want to cover, or rather mention this, that non-healthcare organizations are also getting into healthcare, because that shows the demand on public services delivery. So that's what I want to convey. And the mobile consultation and WhatsApp, the Google Doctor. So these are all different forms of healthcare. I'm not questioning how quality they are and what is the changes or the challenges in that healthcare models. But these are the models that are happening, and some of them may succeed, some of them may fail. That time only can tell that. So let me give my prescription for this, the innovative methods of healthcare delivery. You have seen some examples. There are some overlaps with that previous speaker, the examples that I'm going to quote. I'll try my best not to, or rather to avoid that overlap, and let me see how successful I am. So there are different forms of innovation that is happening in the healthcare, possibly the product innovation, process innovation. I'm happy some of the speakers yesterday also spoke about process innovation and service delivery innovation, service design innovation, and I want to add something more that is called business model innovation. You want to know a little more about this? There is a magazine by our InnoHEALTH, Dr. VK's magazine, latest magazine. In page number 32, some more details about these 4-5 dimensions of innovations are already there. So that's why I will not go into full details of this. And otherwise, as you can see, there are a lot of products that are coming up where wellness, wearable devices, and so on and so forth. I'll not get into this, but I will just interact with you now. Just see this. The information about a very simple, I have taken this example from one of the very interesting books called Predictably Irrational by Dan Ariely. So it's a very interesting thing. Somebody talked about yesterday pricing. One of the very important aspects of healthcare, affordable healthcare models is the pricing. At the end of the day, you have to get the pricing right. This is a very simple example of selling an Economist magazine on website. The web portal has become very, very important media for all businesses. Now I'm going to interact with you for a minute or so. If you want to subscribe to this magazine, now there are 3 options. Option number 1 is just, as you can read that, the first option is 1-year subscription to Economist, including online access to all the issues from 1997, just for $59. I call this as option number 1. The option number 2 is the print subscription only, 1 year print subscription is $125. Third option is both print as well as online for the same price. Now I want to interact with you. How many of you choose option number 1? Can you raise your hands, please? Option number 1. Option number 1 once. Option number 1 twice. Option number 1 thrice. 1, 2, 3, 4, 5. Option number 2. Can someone, Alok or someone from Sachin or someone, can you please note this number of options for option a number of people selected option number 1 is 5. Option number 2. Anyone? Only 1. Option number 3. Option number 3. You have no choice, but you have to choose one of the options. I'm not seeing all the hands rising. Rather, you may be feeling bad that is it a class or is it something else? Very good. At least about close to 10. What is happening to others? You all have to choose these options. You all have to buy. You have no choice. Yes. Can I go back to the option number 1 once again? Assuming that all of you have to buy this. Same again, so some more increase. Option number 2. Option number 2 again. I think V Prasad doctor is also stopped. Change your mind. Yes. Option number 3. Okay, good. Please note your options. Now, because option number 2, nobody has selected. So as a Vice President Sales of Economist magazine, I decided to remove that option number 2. Now how many of you choose option number 1? Please participate in the poll. 1, 2, 3, 4, 5, 6, 7, 8, 9, about 10. Yeah. Second option, or that is the third option in the earlier slide. Please participate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, close to 15. What's happening to others? Had you had your breakfast? I suggested Dr. VK how to start next time onwards on time. So breakfast is going to be embedded. So Dr. VK, please do this. This is my submission. You can start by 8:30 also. Okay. Now what's happening? The same thing has been administered at Harvard as well as at many other schools. I do in my class also. So your pattern here is almost similar to the pattern that is happening in my class. The magazine is same. The options are same by and large. The customers are same. Then what is wrong? What is wrong with the previous slide and this slide? Can you guess? Options. I have not done anything. I have just removed the option which is not being selected by anybody. That's all. That's correct. But no way different from the previous slide and this slide options. 3 options, now 2 options. Yes. Yes. I think earlier one you have to think more. Now you don't need to think. Yes. Yes. So the author in that book, they call it as the option number 2 in the previous slide as decoy, D-E-C-O-Y. Decoy is the option which makes other option to get selected, not that option to get selected. When you go for any job, you get selected. You think it is you get selected? It is the other candidate who makes you to get selected. Please remember. This is the argument. This is what is. The product is same, the price is same, the people are same, but what is the difference? This is what is business model innovation. You call it as anything. This is where in the web, you have so many options today. The people are, the consumers are confused which one to choose. Either I should go to Lalpath Lab or SRL or A to Z or something else. There are too many options. So this is what is happening. So you have to be innovative. Either it is a product innovation, process innovation, service delivery innovation, or business model innovation. I framed it as business model innovation. You may question this, but writing 1-page or 2-page article for Dr. V.K. Singh's InnoHEALTH is becoming very challenging for me also. So this is part of that. So I will not take any more time. Then I will go to this. As you can see from this what is the survey result. And as you can see, the revenue has gone down by 30%. As everything is same. Let us say competition 1 versus option 1 versus option 2. Number of options 3 versus 2. You only removed the option which is nobody is preferring. That is wrong. So from empirically you can prove that. So this is what is that book all about. So if you are interested, please read that book. So some examples, how technology is changing. This is the hospital in Bombay, Aditya Jyoti Hospital, with whom we are working. And the operational model that they are using is the technology. This company, this organization, this hospital is working for the largest slum in the world, that is Mumbai Dharavi. There, they are using community health workers. This is what is community health workers. They go and they are trained on health tabs, and they capture the data right at the source, and they screen the patients who is diabetic for eye care. The diabetic patients are more prone for eye problems than others. So this organization is working for the welfare of this largest slum because they don't even know that they have a problem. This is one example. So this is the simple model that they follow. I will not get into technical details. And these are the project impact. They have been doing it, and they also got some awards. And this gentleman is also is a Padma Shri Award winner, and he is a third-generation doctor, and he is also very close friend of Aravind Eye Hospital. So he is trying to build Aravind Eye Hospital model in Mumbai. So that is one challenge that he is facing. So they have very nice, very portable technologies for eye screening, etc. And this guy is also the marketing channels. He is a big fan of Rajinikanth. And the Kabali movie, when it was released, he was the first ticket in Mumbai city. He named it as actor and doctor. And he works with a lot of good organizations, and that is the collaboration model that he is practicing. What I want to convey here is the collaboration kind of innovation. So this I have taken from our Sachin's project earlier. So this is one example where the technology, how the technology can reach to the bottom of the pyramid consumers like this in vernacular languages. It is not the question of technology that you are developing, a technology for the rural in their native language. That is the challenge. In India, if anybody wants to come to India, every state needs a different model. Every state needs a different model. That is the biggest challenge. Then, so this is taken from the same source, and some of the product features of that product. If you want more, we have Sachin. You can learn from him. In the interest of time, I'm not going to get into that. So some of the examples. The most important challenge here is capacity building at the ground level. So I think Dr. VK is looking at me. I have to close. Yes. So this is another company which is working, iQuick company in Kolkata. So the whole idea is I want to cover whole India and then see how this can be spread across the country. And this is one company, of course, a case study that we have done, and that is coming up in the Asian Case Research Journal very soon. That has been accepted, but it will take at least one more year to see in the print form. So this company is a software engineer. I worked with IBM and other good companies for a while, or at least few years, and he felt that his fascination is towards healthcare, and that to rural mother and child care. This company is specialized in developing customized IT solutions, and if you want more, you can visit this website. You can see more details. And if you are interested, more details, I can share the paper that we have published. So here, the mother and child care, how this web-based model, and he is developing, and of course this product is under patent, is submitted for patent, and you may get patent anytime. So this is the model that is being followed by this company. So with this, I'll conclude that the companies like these in India using a lot of models, customizing to the local needs, that is very important. Either we name it as the healthcare beyond the hospitals or etc. So I have just brought to you some of the examples with whom we are working. So with this, I'll take leave. Thank you so much.
Thank you, sir. Request you to please take a seat. I now request session moderator, Dr. Sandeep Bhalla, faculty and researcher, Public Health Foundation of India, on the dais. Also, I request the panelists of the session to please come on stage. We have with us Mr. Santanu Biswas, founder and CEO, Resident Logic Consulting, FZE, UAE. Dr. Tarun Ramole, co-founder and director, Utilis Capital. Dr. Mukesh Taneja, faculty, Cornea and Anterior Segment Services, V Prasad Eye Institute. Now I request the session moderator to please commence the session.
Very good morning to all of you, respected Dr. V.K. Singh and all the senior officials, those who have come from the different parts of the country, even outside the country, those who are joining this initiative. Let me say a few words before I should start this particular session. I belong to the same alma mater along with Dr. V.K. Singh. I'm from FMC Pune, and I have learned a lot under his leadership because we work together at IHMR also. I'm on the other part of the side from the army, though people are still working in that side, but I have learned the both aspects. And the one of the best aspects which I have learned from the army once I was there is that the dignity, the credibility, the solidarity, and the discipline. And that same thing we are applying in this sector also, in the health sector, once I came out from army. You find lot of leaders in the country, but it's very rare to find the visionary leaders. Yesterday also we have, all of us must have heard the news of Shri Arjun Singh ji. Very eminent figure at the age of 98. You see him, if you have seen him at the age of 96, when our previous Honorable President, he made a visit to his, he was not in a position to even stand up from the wheelchair, but just see his ability, just see his courage. He moved up and he has given the big salute to him. This is what the discipline which Army has created, and I have a big salute to them. And this is what I have learned from Dr. V.K. Singh. Leaders are there lots, but visionary leaders are very few, and he's one of them. And very big thanks to him and big claps to him. Though this session, I belong to now in Public Health Foundation of India, which is a very prominent organization in the field of public health, one of the public health tank in India. Yesterday, my vice president was also here, Professor Prabhakaran, who has talked about biotechnology and public health. Today, The innovation is one of the major word all globally it is going on, and the task which Dr. V.K. Singh sir has taken up, I think today if you are all sitting here, it is only because of innovation word which he has created for all of us to come together. In PHFI also, we have created a lot of innovations, not only in the health sector, but in the other sectors also. And I'm really proud to have a very eminent people on the panel today. Dr. Venkat has already given up a base for that today's session, that health beyond hospitals. We always concentrate on hospitals, hospitals, and hospitals. And the corporate culture which has come up, we are taking up in a different way. We are always looking into a different way. But the innovators like Dr. Devi Shetty, who has created among the corporate also the innovation model. So there are a lot of aspects in the health sector by which we can create an innovation. And one of the model which we are also running in PHFI has created a big innovation in the country, that is building the capacity of primary care physicians in chronic conditions. That is one of the innovative model which I am also leading along with a lot of team members which Dr. Prabhakaran is heading. It has won all the awards, BMJ awards, PhD Chambers award. And day after tomorrow, we are going to have a platinum award from the DL Shah Award Quality Council of India. It's not only winning the awards, but the thing is, innovations are available in this country. And there is a huge potential for innovations. You need a light-minded people to come together and to create such innovations. And the second aspect should be the affordable innovations. We need the affordability because if the cost is huge, there is no point of creating that innovation because India is a mass. And masses need a lot of reach also and the scale also. And until unless the affordable things are not available, whatever innovation we are creating, it is not going to serve our purpose. Recently, the health policy has come up. It's a big buzz now. 2017, the first time after a long gap, the health policy of India has come up. And there is a concept that is universal health coverage. We are talking about a concept of universal health coverage. And the panelists, those who are there, though they are very eminent people, they are very expertise into their own fields. I'm not going to intervene into their intellect level, but I need also, on the other hand, to learn from all of you what you think as an innovation into the different arenas which you people are dealing, so that you people can enlighten all the audience, and we should learn from all of you how you people are doing your work into your innovative areas. So thank you for hearing me, and thank you for giving me opportunity. Thank you. We have three members, eminent members on our panel along with Dr. Venkat, who has given the keynote address. Dr. Mukesh Taneja, welcome sir. He is a well-renowned ophthalmologist with specialization in cornea, and is working at V Prasad Institute, Hyderabad. V Prasad, if you take the name, there are 2-3 names which comes in the eye sector, Arvind Eye Care and V Prasad Institute. It's really a great honor that he is one of them sitting here from the prominent institute. So my question to sir is, sir, we are talking about today scenario, telemedicine. It's a big buzz. And on the other hand, in the chronic conditions, that is another big buzz. That is diabetes. How diabetic retinopathy, which is one of the major cause of blindness, you can think it over in a form of a telemedicine, because in India, the scale is huge. How V Prasad Institute or institutes like Arvind Eye, which has created one of the innovative model in the blindness sector, cornea blind, telemedicine can play a great role to create an awareness of not only the doctors for diabetic retinopathy, but at the ground level workers, ASHA workers, ANMs, because India needs not only the doctors, because doctors are very few. Ultimately, the masses are ANM and ASHAs if you want to treat the diabetic retinopathy issue. So we want to learn from you, from your experience, how LV Prasad Institution or you people can think it about telemedicine role in diabetic retinopathy.
Sandeep, I have a presentation on telemedicine.
Sir, please, sir.